Dr. Vijaybhasker, Chairman, Ethics Committee, Clinical Research and Trials, Hyderabad. Today we'll discuss about the persons after the or during the COVID or after the COVID suffering from joint pains, that is arthritis. Obviously, most of the virus does affect the synovial membrane of the joint. The synovial and synovial membrane and the synovial fluid is the a constitution of a joint where the lubricating fluid formed by the membrane of the joint. So that membrane is called synovial membrane. So obviously the lubricating fluid is called synovial fluid. So when the most of the viruses does affect the fluid of joint, that is a synovial fluid, leads to joint pains. So these joint pains usually wean down as the virus goes out of your body, or it is acted by upon the immunological system or antibodies of your body. Once the antibodies are acted on the virus of the generalized system, then obviously the virus effect on the synovial fluid will come down. So obviously initially when there is a viral effect, then leads to a infection or localized inflammation. That means pain and swelling in the joint, and then the restricted movement of the joint. This does will sustain for a little longer period, and sometimes many months and days. So obviously people scared of it. Why is being affected the joint pains even though the virus is gone out of their body. So usually what exactly happens, the pathology when there is a infection, the viral infection, initially the virus effect on your body will be around 10 to 14 days. After the 14 days, the virus automatically killed by the antibodies in your body. But obviously the side effects of the virus, does it means that when there will be a chronic disease process in the joint synovial fluid and synovial membrane, where it takes longer time to recover from those complications or side effects developed by the virus. So any joint pains, especially knee joint pains, when there is a large area of synovial membrane with large much more quantity of the fluid, that fluid does affect the joint variability, wear and tear, and then obviously in older age group, obviously there is a degenerative changes, and there is a some side effects and complications in the joints leads to the pain which sustain for the longer time. So anyway, as such, there is nothing precautions you can take for the virus, because virus, when, how, where it enters into your body, you do not know. So even if a few number of persons only get the joint effect due to the virus, not all the people who are infected with virus will not get the complications like joint pains. So this joint pain should rule out with an infective joint pains, and then immunological disorder joint pain like rheumatoid arthritis, gouty arthritis, or psoriatic arthritis, or even in old age group degenerative osteoarthritis. So apart from this, even the traumatic arthritis also will see in most of the cases, in which we have to rule out with all the tests and then come to conclusion that could be cause is virus effect. So the COVID virus enormously, it is into the worldwide pandemic spreading, and that time there are many people are suffering with fever, sore throat, pain, and with these joint pains. So obviously such problems will persist for longer time. The choice of investigation is RT-PCR to rule out the virus is existing or not, or what type of virus it is, and then treat accordingly the virus treatment. Apart from that, the basic line of treatment is the painkiller, something like a paracetamol or diclofenac sodium, with regular physiotherapy does really helps them to rule out. So basic x-rays and then basic blood picture, and then you do the basic investigations, and then once you confirm that it's in a viral effect, then treat symptomatically so that the patient will recover. ఎన్ని నిమిషాలు సార్ సార్ రండి
5 minutes.
ఎన్ని నిమిషాలు
5 నిమిషాలు వచ్చింది సార్.
2 minutes ఇట్లా చెప్పు, 3 minutes 4 minutes 5 ఇట్లా చెప్పు నాకు.
2 minutes అయ్యారు సిగ్నల్ ఇవ్వాలా సార్?
2 3 4 5 2 4 minutes నువ్వు 2 సార్లు చెప్పు చాలు.